I'm Jake Scott, and I'm doing my ankle assessment, and this is my partner Kyle Font. So when the patient walks in, the first thing you're going to do is ask them history questions, starting off with primary complaints. Some primary complaint questions are, where does it hurt, what hurts, and rate it on a scale from 1 to 10, 10 being the worst, 1 being the best. So after you ask them the primary complaint questions, you'd go to an MOI. So you'd start by asking how you heard it, what were you wearing, what was the turf or field was like if you stepped in a hole, inverted or everted your ankle. And obviously I wouldn't use evert and invert because you probably know what that means, but I'd say this is invert, this is evert. And then, alright, so after MOI you go to characteristics of symptoms. So you would start by asking what kind of pain is it, what does it feel like, is it a sharp or dull pain, did it happen suddenly, did it happen over time, how long have you had these symptoms, and yeah. Alright, so after asking him the characteristics of symptoms questions, you'd go to limitations and ask him, does it hurt when you jump, does it hurt when you walk, does it hurt when you run, does it hurt when you jog, does it hurt when you sit down, does it hurt when you lay down, does it hurt when you stand on your tippy toes, and then I could show him some stretches or something and see if that hurts. I'm going to cut that part out, but you can stop now because that was good. Alright, so after limitations, you're going to ask him some past history questions. Like, have you ever broken a bone in that area before? Have you sprained anything in that area before? Have you tore a muscle or a ligament in that area before? Have you felt pain like this ever before in that area? And, yeah. Alright, so after history, you go to observation, and you would check first for the anterior view, so face me. And then you would check for his toe alignment and the position of his foot. And then after the anterior view, you would go to medial view. So you turn him to turn over so you can see the inside of his foot. And then you would check for a high arch or a flat foot. And then you would ask him to turn around and see the lateral view. And then you would check for swelling on his foot. And then you'd go to the posterior view and ask him to turn around. Then you would check for a slight valgus turn, and then you'd ask him to stay on his tiptoes. Stay on your tiptoes. Then you check for any weight distribution problems or and the alignment of the Achilles. And then you'd ask him to walk away from you. Go that way. And then walk back, checking his gait for his stride length. And yeah. Alright, after standing observation, you'd ask him to lay supine and go supine observation and check obviously the anterior view. And you'd observe his toenails for ingrown toenails and check for bunions and hammer toe. And then you'd ask him to spread his toes, just to be a dick, because I know that hurts and gives you cramps. And yeah. The supine observation, you'd ask him to lay on his stomach for the prone observation, and you look at his plantar surface and observe for plantar warts, calluses, ulcerations, and then you'd also palpate his plantar fascia to check if for any tenderness, which could result in plantar fasciitis. Alright, and then after prone observation, you go to palpation, and to start out, you look at his medial and lateral malleolus, and then also palpate the area of the tibial nerve, which is posterior and inferior to the medial malleolus for any tenderness, and then you check his posterior heel. Posterior heel, both sides of the Achilles tendon for any tenderness. And then you go to the peroneal tendons, which is posterior and inferior to the lateral malleolus. You check for tenderness there. And then you move over to the anterior ankle, and you check the posterior and anterior talofibular ligaments for any tenderness, and then also the calcaneofibular ligament. And then you'd move over to the plantar fascia. And again, like I said in the last one, check his plantar fascia for tenderness, which could result in a plantar fasciitis. And then the MTP joints, which are on the top of the foot, and you check for tenderness and swelling. Alright, and then after palpation, you move over to range of motion, also known as ROM. And then first you start off with dorsiflexion. In order to do dorsiflexion and plantar flexion, you would go the connecting part on the lateral malleolus, and then you line it up with the foot. Then you'd ask him to plantar flex, and then you'd measure the movement of the foot, and then that change should be 40 to 50 degrees. And then you ask him to relax his foot, put it back. Then you'd ask him to dorsiflex, and then that should be about 15 to 20 degrees lined up with the foot. And then you move over to inversion and eversion, and for that you put it on top of the foot, then ask him to invert his foot, and measure the change in the goniometer, and then that one should be 25 to 30 degrees, and then ask him to evert his foot, which should only be a 20 and 25 degree change. And yeah. Alright, and after range of motion, you move over to muscle testing, and to start off, you test the posterior tibialis. In order to do that, you'd ask them to invert while resisting it to check for any weakness in the posterior tibialis, and then you move over to anterior tibialis and ask them to evert their foot while you resist it going inverted to test for weakness of the anterior tibialis. Then you move to the pronatus, longus, and the brevis, and then you ask them to plantar flex his foot and evert, and then resist eversion to check any weakness in the pronatus, longus, or brevis. And then for extensors, you'd ask him to extend his big toe while resisting to check for weakness in his extensors, and then you ask him to flex his big toe and resist his big toe to test for the flexors. And then after muscle testing, we're going to move to special tests, and there's many special tests, and for this one I'm going to show you two different ones, the apprehension test and the MTP test. And the apprehension test, you're going to locate the ATF first of all, and then you're going to have him plantar flex his foot just slightly, and then invert it to check for any instability or looseness of the ATF. And then after that one, I'm going to show you the MTP instability test, and that one you're going to plantar flex and dorsiflex all the phalanx, the proximal phalanx, and then check for instability of the metatarsal phalangeal joints. And that concludes my patient assessment. I'm sorry that one.
Do you have the time to listen to me whine about nothing and everything all at once? I am one of those.